All right, folks, in respect for those of you who are here on time and need to, you're utilizing your lunch hour, we'll go ahead and get started. Anyway, good morning, everyone. Thank you all so much for participating in this, the third of our 4 virtual ICDP Disaster Symposium presentations. My name is Barb Clark, and I'm the Training and Exercise Manager for the Intermountain Center for Disaster Preparedness, located here in Salt Lake City, Utah. As we look at our world anew, we hope that you find some comfort in hearing how others have dealt with various tragedies and disasters and have come out the other side stronger and more resilient. Although the networking opportunities is not the same on this Zoom platform as it was in person, if there is someone that you want to connect with following the presentation, please let me know and I'll do my best to connect you. Following this and all of the 2020 symposium presentations, you'll receive a survey from SurveyMonkey so that you can tell us your thoughts and help us develop a stronger symposium in the future. We all hope that by next fall, we'll be in a position to return to in-person gatherings. Also, if you need a certificate of participation for this or any of our presentations, please let me know. You can just send me an email and I will get you a certificate. As a matter of housekeeping, please follow common virtual meeting courtesies by making sure your microphone is on mute. You can choose to keep your video on or off. And if you have questions, we will be monitoring the chat area. So please submit your questions during the presentation through that portal. If it's something that needs an immediate response, we will go ahead and ask our presenter to answer your question, or if it can wait till the end, we will wait till then so as not to interrupt her. But our presenter today, Ms. Milner Leon, has requested that she get some dialogue. She likes to present in that manner. So if she asks a non-rhetorical question, please feel free to unmute and share your thoughts or answers at that point as well. When we come to the end, we find that it works well if you do unmute and ask your question that way. Also, if you wouldn't mind, please change your display name on your video to include your first and last name. That way I can give you credit in your Train account for attending. And if you're watching with a group, if you could please email me their names. And if they have not registered, you can just email me their numbers, but please include who your group is so that I know, who's been participating. That really helps us. We run these programs, especially the symposium, through grants that we receive from the state, from the ASPR group, and we need to account for our participants as well. If you need help changing your name on your video screen, please let us know in the chat and we'll send that as well. And I will also write that up when I'm done talking to you. So again, thank you for your continuous support of the Intermountain Center for Disaster Preparedness. And if we can be of service to you or your organization, please reach out. We're here to help. All right, so without further ado, I would like to introduce you to our speaker today. Our speaker today is Celina Milner Leon. By the way, this is her anniversary, so congratulations and happy anniversary.
Thank you.
As well as, and I forgot to say this earlier, as well as happy Veterans Day. Thank you all of you who have served our country and supported us. We really do appreciate it. So back to Celina. Celina's passion and enthusiasm is in serving diverse, multicultural, historically marginalized communities. Prior to serving in Mayor Ben McAdams' inaugural administration with Salt Lake County as the Community Liaison and Special Projects Director, Ms. Milner Leon worked in the travel and hospitality industry where she worked to bring conventions, conferences, and designation travelers to the Salt Lake City area. Following her time in Mayor McAdams' administration, Celina worked on Project Lead the Way as the Director of School Engagement in Utah and Nevada, providing K through 12 STEM programs to help students develop the skills necessary to succeed in our global economy. Public service came calling again when Salt Lake City's Mayor Jackie Biskupski's office asked Celina to serve as the Senior Policy Advisor for Diversity and Human Rights. To further promote the mayoral priorities of diversity, equity, inclusion, and belonging, Celina has continued in that role in Mayor Aaron Mendenhall's administration. Personally, professionally, and politically, Ms. Milner Leon's work to bring businesses, communities, and governments together through information, innovation, and inspiration. Her experience has shown how to find common ground and collaborate on effective solutions. In her spare time, Celina devotes her personal efforts to organizations that follow on the empowerment of women, safety of children, and the advancement of underserved communities. In addition, in her free time, she is also writing a book called The Birth of an Election: What to Expect When You're Electing. This is a woman's guide to running for office. Please welcome Celina Milner Leon.
Thank you, Barb, so much. I greatly appreciate that. And good afternoon, good morning. Thank you for spending your lunch hour with me on Veterans Day. I am absolutely honored. And if you listen through all of my bio, you did not hear emergency management once. I, by no means, come here today as an expert in emergency management, but my background has been in diversity, equity, inclusion, and belonging. And so even this morning, I thought, how did Barb find me? And she said that she heard me on, it was an NPR or KUER interview talking about equity in an epidemic. Equity in an epidemic, diversity, disasters do not discriminate at all. I think we know that. But how do we have equity in emergency management? And this has just been bubbling up for me over the last 8 months as COVID hit. So I'm just going to spend the next couple of minutes just sharing a little bit of stories of what I saw firsthand and experienced at the state level, the county level, and even at the city level on, you know, some of the inequities that I saw that came up. So this is talking about applying an equity lens to emergency management. You know, early on in this pandemic, I think it might have been either March or April, somebody posted and they said, you know, what is the silver lining of this? And I thought, oh my goodness, how optimistic already. But what is the silver lining? And they said, what is the gift that you're finding now in a global pandemic? And the one thing that I took away from that is the gift of this global pandemic has been the exposure of all of the inequities that in my field we've been discussing for decades. So it's been the exposure of those inequities, but it's also been the elevation of equity efforts. I think, you know, some of these inequities were right in front of our face, and so we had to deal with them, and that the gift of the global pandemic exposed those inequities, but then also elevated the conversation. And so, you know, probably in July, I would tell people that I was working as if my hair's on fire because of all of the efforts in so many different directions that we were trying to overcome. So I realized early on that we needed to have an equity lens on emergency management. There we go. Well, let's go back. Okay. Equity versus equality. I think you all understand what that is, but what I realized is that emergency management practices rely on providing equal access to resources and services in order to prevent, mitigate, respond to, and recover from disasters and large-scale emergencies. They rely on well-functioning existing structures and relationships within a community. This approach is generally not well-positioned to address the needs of the community's most vulnerable members. Overall, the emergency management field focuses on the principle of equality rather than equity, leading to different outcomes than if the lens shifted to incorporate more of an equitable work, if we center equity. We know that more vulnerable populations fare more poorly during responses to and recovery from large-scale emergencies and disasters. And I almost wanted to add large scale and ongoing. I think this is the first time, at least that I've seen in emergency management, where we're not talking about a one-time disaster. We're talking about an ongoing global pandemic with, in Salt Lake City, Utah, inserted by an earthquake, numerous aftershocks, racial unrest, inland hurricane. I mean, over the last 8 months, I think we've been able to take a look at our emergency management policies, procedures, and protocols even more closely. And I was telling Barb and Dr. Blackwood at the first that what happens in an emergency and in a disaster, what I've seen and in a couple different responses now is when there is an emergency, large scale, mid scale, pull out the binder, go to the file. We've been practicing this, and what happens in some communities is you pull out that emergency management disaster recovery binder and blow it off. Do you know what I mean? When the last big scale, large scale emergency disaster happened, open it up and it's like, this is what we need to do. This is how we need to respond. But it may not be relevant to the constituency in the community constituency, the city, the municipality has developed and come a long way. And if those policies, procedures, and protocols don't necessarily reflect the change in the community, that's where we start finding a lot of inequities. So nobody wants to look back, but sometimes we have to know where we've been in order to know where we're going. And at the very first of mid-March, COVID, as soon as everything completely shut down, schools went remote, online learning, businesses closed, workplaces closed. The first thing that I started talking about was digital equity and access. I've been fortunate enough, or maybe unfortunate, I don't know. This has just been a kind of a passion project of mine for a while, is focusing on digital equity. But I had to raise the digital equity flag to say, that's great that all of this coronavirus information is going out digitally, but if you don't have access to online services, you're missing a whole swath of individuals and community that are not going to be getting this message. It's 33% of households, so households that make under $30,000, 33% are not connected in their home to the internet. The internet is still very much a luxury public utility that is optional for most families. And so immediately when coronavirus closed everything, I've been talking about digital equity and access for quite a while, but what I found is in the past, they would say, well, because I said families aren't connected to the internet, they need to get connected, students aren't connected, and they said they can go to their local coffee shop, they can go to their local rec center, they can go to the community center, and they can get online there. And again, in COVID, as we all know, everything closed. Community centers, libraries, rec centers, coffee shops, overnight, their access that they normally got around to was absolutely closed. Important information was going out about school, important health information was going out, but we have to continually put that lens of, that's great if they have digital access. So I threw in some definitions here. Digital equity is the condition in which all individuals and communities have the information, technology, capacity needed for full participation in our society, democracy, and in our connectivity. And digital equity, there's three components of digital equity. It's connectivity, so it's either broadband, wireless, hotspot, so it's the physical connection, it's the equipment. Some families and communities and neighborhoods don't have the necessary equipment or even the updated equipment. And then the third component is digital literacy, because then what also happened is it was like, okay, we need to get these families connected. We need to get them online. If we're going to be sending out information digitally and online, what can we do? And so the community that's been working for digital equity, Utah Communities Connect, it's Utah's Digital Alliance. I've been a member for a few years now, jumped into action. Comcast came to the table. A lot of the internet providers came to the table trying to hurry up and get these communities connected. But we had some really, really interesting discussions with our civic engagement team and even with our emergency management, where it was like, it was almost as if we can't communicate and reach individuals who need this important public health information online, how do we reach them? And we had so many meetings where it was like, we got to go old school, get out the flyers. Who's done some flyers? Who's done some postcards? But I think that has to be, if you can have a digital equity overview built into your emergency management response, then at least you're going to put on that lens and be aware that all of this beautiful, curated, crafted information that is going out, this important information, but if it's not reaching the community, the said community that it's intended for, because it's only going out online, we have to have other options. We have to have other options of how to communicate with individuals. Digital accessibility is a little bit different, but I thought very relevant as well. This is something that I've worked in digital equity for a couple years, but this was the first time, probably about 2 years ago, is when I heard about digital accessibility. Digital accessibility is the process of making digital products, all of our beautiful websites, mobile apps, and other digital tools and technology accessible to everyone. It is about providing all users access to the same information, regardless of the impairments they may have. Accessibility is all about inclusiveness, a way to ensure that no one is excluded. As more services become digital, the number of people using the internet increases. One of the biggest upsides to an accessible website, it's accessible website and or universal design. You might be familiar with universal design as well, is that it provides a better user experience for everyone, not just for people with disabilities. And so typically this is for hard of hearing or deaf community, low vision and or blind community, but we want to make sure that in an emergency, the information we're sending out, the beautiful flyer that we created to go to the coronavirus website, the hotline, when we're sending that flyer out digitally and online and posting it on social media, we need to make sure that low vision, blind individuals can read it with a screen reader. There's a whole area. I mean, there's companies that literally do this, where they will take your website and make sure that it's digitally accessible. But sometimes you want to make sure that you just build it in from the beginning. So again, I'm no tech expert. I'm no emergency management expert. I have a passion for making sure that digital equity is available to all. But if you want to make sure that anything you're putting out is digitally accessible as well, that was the biggest thing with coronavirus, because again, even at the state, all information went online. And this is also a good place to talk about health equity, because in the middle of coronavirus, all doctors' visits, everything shut down. So if you have the technology to get online, that's great, and the digital literacy to navigate that as well, then you have access to your doctors, your children's doctors. But just think of communities that do not have that connectivity, do not have access to that equipment. And then even if we do get them connected and the equipment, do they have the online navigation skills that can help them? And I thought it was interesting because I'll point out that I won't name which institution, maybe I should, but I won't name which institution of doctors that I go to. But in coronavirus, you had to, everything went online. So I had to download the app a couple times and upload it, and wasn't working, something wasn't working, trying to get into my doctor's. When I finally called their tech helpline, they said it was only compatible. The app that was created to push everything online for our health was only created with the latest and greatest models of phone. And I am frugal and do not have the latest and greatest. And so I asked the tech support, I said, so you're telling me I cannot download this app, and I'm digitally savvy, to connect with my doctor because I don't have the latest model of said telephone and device? And he said, currently, we're looking at whatever they call it, to connect to others. But at the time, back in March and April, I was not able to download that until they made it a little bit more accessible. And I thought, if I'm struggling with this, what are other communities up against that may not have the privilege and the access that I have? Another thing that came up in emergency management was language access. And I thought this was really interesting because I had participated in Salt Lake City's JIC team, or Joint Information Command Center, 2 years prior, going to all of the meetings. And I guess I had just kind of assumed that we had a plan in place for different language access. We had just kind of assumed that. So when COVID hit, we closed on March 16th. Earthquake happened on March 18th. I was called into the JIC Center, went over to the public safety building, was working that day, and I realized very quickly that a lot of that immediate emergent information needed to get out to the communities was not going out in any other language. It wasn't going out in any other language but English. And I was like, wait a minute. We have this whole constituency that speak multiple different languages. I mean, I really, but then I kind of looked at myself and I was like, maybe I should have asked that 2 years ago. I should have asked to take a look at that. But in practice, we learned really quickly. And it was really interesting because I was also appointed to the governor's multicultural subcommittee, the COVID advisory subcommittee, in April as well, when the numbers of coronavirus came out and showed that the diverse and multicultural communities of the state were disproportionately being affected. The governor assembled all of us and basically was like, why do you think this is happening? And all of us were like, there is no information in any other language going out besides English. So you're trying to warn a community, a state, a neighborhood, a municipality about something that's going on. But if you're only sending it out in one language, you're very much going to miss a lot of individuals, households, families that just don't have it. And if we're only sending it out in English and online, digitally, we're not capturing everybody. So I thought it was really interesting that even at the state level, the county level, and at the Salt Lake City municipality level, we did not have a language access plan, a policy, a plan, or even protocol in place. And so I felt that really, really heavy. And what we've done now, we'll talk about the good, bad, and ugly, but what language access means is the rights of individuals with limited English proficiency, LEP, to receive meaningful access to federally funded state and federal programs. So when there's information going out about public health orders and crisis, we need to make sure that we're reaching out to those individuals. Limited English proficient refers to individuals who do not speak English as their primary language and have limited ability to read, speak, write, or understand English. What the state did is the National Guard actually stepped in, the National Guard and their linguistics unit stepped in and immediately started helping with different language services for the state of Utah to get out their coronavirus. What Salt Lake County did, what Salt Lake City did, is quickly began writing our language access policy that we could put into place. I should mention too that with digital equity, Salt Lake City also passed their very first digital equity policy this year. It's something that had been in the works for 2 years, but now, again, because of the exposure of the inequities and the elevation of the equity efforts, we were able to push that through and get Salt Lake City's digital equity policy. So Noel Walkinshaw, my colleague, worked on that. Another thing that we found when we cracked open language, and I was telling Barb and Dr. Blackwood at the first that, again, in Salt Lake City, we realized we did not have a language access policy in the books or a plan or protocol. So very quickly, we were building it as we were responding to COVID as well. And we realized that we had a discussion on, you can't just translate something from Google Translate. You can't just, if it's Spanish, you can't just translate something into Google Translate, because in Spanish, if you would say usa una mascarilla, when you're saying ponen una mascarilla, usa una mascarilla, you're talking more about like a mask than a face covering. And so you need to translate face covering, cubra boca, usa una cubra boca, like cover your mouth covering, make sure to use a mouth covering. And so you want to make sure that you kind of have those languages identified. Barb and Dr. Blackwood and I were talking about that prior, where we quickly ran to Salt Lake City School District and we asked Salt Lake City School District, what are the top 5 languages spoken by families in the Salt Lake City School District? And so we identified the top 5 languages and immediately started translating public service announcements, mayoral emergency declarations, public safety warnings, everything into at least those 5. And that's where you can start. If you don't have a language access plan, or policy in place, you want to start with that. But you also, in an emergency, we just picked out we identified the top 5 languages and then started pushing out all of the information in those 5 languages. The Mayor Mendenhall has expanded, and she now does up to, I want to say it's like 16. She's up to like 15 or 16 different languages that any information coming from our office are pushed out in those multiple languages. The other thing that we found that, again, I had not thought of before is not only in language access to make sure that you're pushing out information in different languages, but the information itself. I don't know if this is something that you talk about in emergency management, but what we learned in COVID is reading comprehension. And so we learned that plain language is the process of presenting information in the most effective way. Plain language must be comprehensible the first time reading it and accessible to everyone. It's very much about simple language, and it's simple language, and I'll say this for a couple reasons. It's simple language because if you have public health executive order that goes out, you want to make sure it's clear, current, correct, but it's also very simple because that allows for faster translation as well. If we can have something that's very much in plain language, it's easier to submit it to the translation department and interpretation department to get it out in those multiple languages, because you start with a simplified reading comprehension. It's kind of like the example of how do you tell someone to make a peanut butter sandwich if they have no knowledge of doing that. Language must be broken down into basic steps and in the right order, exactly what you want individuals to do. What we found at the state is really interesting because the state, the county, and the city were working very closely as far as, okay, if we don't have language access plan, let's get this. If we need to have reading comprehension, if we need to have plain language, let's get that. And we did find out that the state's coronavirus website is at a reading grade level 36. So it's at a very, very high technical level of reading comprehension. But what happens is that makes it, then you have to have experts in that area, translators, in order to hurry and get that information out. And again, that was another hurdle that came up where we were talking about, why isn't this information, this important information from the state going out in different languages? And we found that our interpreters and translators were like, this is heavy duty, high level jargon. And so it took a while for it all to be translated in the multiple languages. So just make sure that whatever you're putting out is in a little bit more plain language, simplified language, detailed language. The goal is to bridge the gap in information, and using plain language also allows for translations to be faster. Okay, so now I'm going to talk about disaster justice or just recovery? And I should have put a poll in this slide, but let me see if in the chat I can get, I'm kind of curious to see who's heard about this and who has not heard about that. So as I jump into disaster justice or just recovery, just put a yes or no in the chat, and maybe Barb and Dr. Blackwood, you can kind of take a look at that and let me know how that's coming in. But I'm curious if this topic has come up. And then I'll jump into, there are 4 principles of just recovery. This is from a book that I read by Dr. Alessandra Gerelman. It's Disaster Recovery Through the Lens of Justice.
Hey,
And
Celina,
so,
excuse me a
yes.
second. It's, most people are saying no. There was 1 yes so far.
Oh, that's good. That's really, really good. That's good, because I wasn't for sure as well, but I know that at the very first of COVID, I was connecting with other municipalities. So a lot of other municipalities across the country, specifically in the East. So my colleagues and my counterparts in the East, I have connection with, and I was literally asking them, you know, what are you seeing in your community? What's coming? Like, what is the next, you know, what do the last 2 weeks look like for you? Because then we can almost anticipate. And that's why I kept saying I was watching the numbers that were being reported by the Department of Health. We were watching in April, March and April. And I knew back east that the multicultural diverse community was being disproportionately affected by positive COVID cases. So I was really worried that that trend was going to continue, but I needed to know about it. So I was connecting with my colleagues, asking the Department of Health. I know that they had the demographics, they just weren't releasing it at the time. I'm not for sure why, but we were persistent, pleasantly persistent, and the numbers were released the Friday. The demographics came out the Friday before Easter weekend. It was Friday after 5 o'clock that they were public, right before Easter weekend. But immediately when I dove into the numbers, I could see that Hispanic and Latinos in the state of Utah make up 14% of the state of Utah, and yet we're 44% at that time of the positive COVID cases. And so that data for me was enough to ring alarms saying, okay, I need to warn the community. This is why I need the community. I need information that's translated and accurate. We're not warning this community of what's coming in a timely manner, in their own language, where we weren't meeting them where they were at, getting this information out to them. So it was really interesting. But through my colleagues back east, I learned about, they said, you need to plan now for disaster justice and disaster recovery, or just recovery. And I was like, wait, what do you mean? And I kind of wasn't for sure. And they're like, Celina, in every disaster, there's disaster capitalism. You have disaster capitalism where entrepreneurs try to capitalize on said disaster in whatever way they can. And there's kind of some disaster capitalism that starts happening right away. There can also be disaster justice that happens right away. And so it's something that I have learned over the last 6 months, just diving into it, where we need to plan for this as well. The principles of disaster justice or just recovery requires the ability to exercise agency. All community members, regardless of their socioeconomic status, race, gender, sexual identification, land tenure, or other factors, must have the ability to fully exercise their agency and make free and informed choices that support their personal well-being. This is not possible if this is direct or indirect coercion, exclusion from public policies, or other barriers to participation. Furthermore, agency cannot be fully exercised if all options are not understood and made available in a timely manner and through accessible means, digitally accessible and inclusive. Equality. Just recovery begins with equality. The principle of political equality, which establishes that only equality is inherently defensible, different or unequal treatment must be justified by the discriminator. Bureaucratic processes that force disaster-affected individuals or communities to prove their deservedness puts the onus to justify the need for equal treatment on the victims, and so the test fails. Capacity, just recovery harnesses community capacity, capturing the transformative and adaptive capacity of communities and honoring their definitions of resilience can reduce future risks. Holistic disaster risk reduction is not possible without acknowledging existing patterns of unequal risk distribution. It is not sufficient to mitigate against current risks when rebuilding. Instead, underlying social structures and patterns must be questioned. Colorblind and ahistoric recovery that does not consider context is not just. And then equal access. Just recovery requires equal access. Without equal access to resources and programs, including full participation in decision-making, processes that govern resource allocation, future development, and other functions, it is not possible for communities to effectively participate in their recovery. And so a couple of stories that I saw about this is when we were working with emergency management and the Salt Lake City JIC and even Salt Lake County Emergency Command, we were trying, and also from the governor's multicultural subcommittee, we were trying to reach out to different communities. And we realized that the same messaging wasn't being received, you know, when you just can't say, okay, everybody has to stay home and stop going to work. The diverse and multicultural communities were like, yeah, that's not going to happen. And they have to go to work. They're essential workers. And so they have to go to work. And so by telling them to stay home, that's not what they were going to do. So then we had to remessage it and approach and realize, you know, do you have the proper personal protection equipment to go to work? And this is why you need personal protection equipment. And we even found little nuances within the Hispanic and Latino community, for example. The women were wearing masks, the children were wearing masks, but the men were not wearing masks, and we weren't for sure why. Even with my own husband, he works in the trucking industry, and he was out and about continuing to work while I was transitioning to work from home, privileged enough to transition to work from home. And he sometimes, I'm like, you have to wear a mask, you have to wear a mask. And we, after taking a look and asking around really quickly within the community and families and pulling some of the women in and asking, you know, what's going on? And they're like, it's not, it's showing almost a sign of weakness to wear a mask. It was kind of considered a macho thing where it's like, I don't need a mask. I don't need a mask. And so then we put together a focus group that had all male centers of influences from the Hispanic and Latino community to come on and talk about how it's very much just a good thing to put your mask on so that you can protect your family. You don't bring it home to your family or anything like that. So we found different, but it was because we stepped in and talked to the community about the messaging that would resonate best within their community and find out. We've had, it's been really interesting because right now Pacific Islanders are affected by COVID the most, and we're trying to figure out the mess. I mean, like what is working, what is not working. Even just 2 weeks ago, yesterday, we lost a beautiful community health worker, Margarita Sattini, to COVID. And she was one of the individuals that was actively working within her community to educate and outreach about COVID and how to protect your family. And so over the last couple of weeks, we finally reached out to several gentlemen who are centers of influence, honored individuals within the Pacific Islander community to deliver a message that would resonate now more than ever. Because obviously, if we come from the state, if we come from the county, we come from the city, you know, maybe it's, you know, bureaucratic that people don't want to hear from, where it's like, you know, this is why, this is what we must do, this is what's going on. And it wasn't working within the Pacific Islander community. And so we asked, and these individuals are now consulting, working within the families and the community health workers to talk all about why at this time we have to put our traditions aside. We cannot gather as we once did. We cannot hug and kiss. We cannot we have to put almost our culture and our traditions, our cultural norms and our traditions aside right now in order to save our very family and our individual and our community. But it was only because we flipped the model on its head, where instead of Salt Lake City coming to whatever neighborhood or community and saying, great, we have all of these resources for you, we asked the community leaders to let us know whatever they needed, and we took our cues from them instead of us leading out. What are some of the next steps? What are some of the next steps to implement and incorporate disaster justice into a just recovery process now for an ongoing pandemic, but also in the future for anything that comes up? I listed these 3 steps that seem to be pretty consistent with a lot of my colleagues that I talked with. Identify needs and assets now, as well as pre-existing vulnerability and resilience. And here's a question too that just I wanted to ask, another interactive question. When COVID first hit, I said, we're all gathering, state, county, city, everybody was meeting, we're all working together. And I said, what about vulnerable populations? And I had a colleague that said, oh, the homeless and unsheltered, we're taking care of that. I'm like, no, wait a minute. I said vulnerable populations. And it was really interesting because at the time, government, at least in municipality and county and at the state, identify vulnerable populations only as homeless or unsheltered. And I immediately said, that was in March, where I was like, we need to expand that definition so that when any of us are talking about reaching out to a vulnerable population, it's not just homeless and unsheltered individuals, but the lens needs to go wider on that aspect to make sure that we're including the differently abled and accessible community, the diverse multicultural community, and a lot of the other different communities within one said constituency. So Salt Lake City, state of Utah did that. The Multicultural Affairs Office did a beautiful report right at the very first. They sent out a survey within the first, I would say, 10 days of the pandemic. They sent out a survey to all of their multicultural partners across the state. And I think it was 90 plus partners for a survey that said, what is your community facing? What is going on? Like give me a little bit snapshot of the community. And that resulted in a beautiful 80-page report that is absolutely amazing, that helps us identify the needs at the state level, but it can also be broken down locally to your respective county, municipality, township. When you're doing, yeah.
We have a question here that you might be able to answer at this juncture. Jody asked, you mentioned about the Mayor Mendenhall's communication comes out in 16 languages. How is that distributed or accessed? And he wanted to know if there are certain places that the different communities know to go to look for communiques.
Are they talking about multicultural communities? Do multicultural communities and diverse communities know where to go?
Jody, would you like to unmute and answer?
I'd love it.
So, yeah, you're talking about, obviously there's a great need to get information out in more than just English. But, and I don't live in Salt Lake, live in Southern Utah. So I don't see, Mayor Mendenhall's information coming out. My question is you produce it, but how do you get it out? Is there good avenues to get it to those communities, to those people that need that information? Because if I did it in 5 different languages for our hospital, I wouldn't know how to do it other than just post it on Twitter. I mean, I don't know a good way to get it to those communities.
No, you're absolutely right. And that's where, the sad thing is we push it out digitally, online and digitally only. But what we have done in the background is created partnerships. So Salt Lake City Mayor's office has always had, I'm part of her policy advisors. There's a team of policy advisors, and we even have a team of community outreach or community liaisons. We have a base of all of the different, so we have relationships with the different multicultural and diverse communities throughout Salt Lake City. Like that is our job, to make sure that we're connected and we're not missing anyone. What we didn't have is we didn't have the overall language access policy. So again, deciding how best to reach out to the community, we went to the Salt Lake City School District, but we also have access to Kim Gardner. I think it's a statewide, they kind of plug in the census efforts were going on this year as well. So we reached out, had the Salt Lake City School District identified languages, had our census information, and we came up with, okay, these are the top 5 that need to go out for March, April, and May. And then she expanded that. But we were sending it out through these partner organizations. And that's where the next one include, when you include vulnerable populations, we can put diverse, multicultural, just include different populations into your planning process. That's something that should be done pre-pandemic or, pre-emergency. If you can establish that relationship. What we also did for Mayor Mendenhall is we'd had it and we'd done it to other administrations, and we were all well connected, as we connected her with the diverse media. So in Southern Utah, you have several diverse media groups that once you establish, here's the proclamation that has to go out or executive order, here's the translation, you can pass it over to them to disseminate to the community. But we also very much heavily relied on a lot of our community-based organizations, our nonprofits. It was really interesting to see everything close in coronavirus, so just shut everything down, but people began to heavily rely on their school, their teachers, the teachers and the school. And I think that the teachers just don't get enough credit, or maybe they need some hazard pay. I don't know who's on this call, but let's just say teachers need hazard pay and essential care pay. But so then we also went to the Salt Lake City School District. We reached out to them and we said, okay, the mayor's got some emergency proclamations, declarations that are going to be going out. We're going to send them to the school district. The school district is going to send them out, because people were heavily relying on their teachers and also their faith leaders, their pastors. And we were seeing that, people were very much, in fact, that same weekend that the racial numbers, the racial demographics were exposed on Easter weekend, the mayor called an emergency meeting, and we had an emergency Saturday meeting. And I said, we have to warn the community, the Hispanic and Latino community at the time in April were being very much disproportionately affected by the positive COVID cases. We have to warn them. And I said, wait, everybody goes to church 2 times a year. That's so bad. It's Easter and it's Christmas, but Easter was that next Sunday. And so we put together a list of all of the faith-based leaders, all denominational faith-based leaders in Salt Lake City jurisdiction for Mayor Mendenhall. And she drafted a beautiful letter to the faith leader that just said, this is what we're seeing. If you could please communicate this to your community, maybe in your Easter message, do you know what I mean? Just asking to help get that information out. So we used community-based organizations, faith-based leaders, and I can put you in contact with the diverse media list that we have so you can help with that. So hopefully that answered your question.
Yeah, it did. Yes. Thanks.
Thank you so much. I appreciate that. Just make sure, that's what I'm saying, when you identify the needs and assets, include the vulnerable populations or diverse and multicultural. We don't need to say, there's all different ways to say this, where it's marginalized, underserved, but just making sure that they're involved in your planning process as well. And then communicate with diverse and multicultural constituency. That should already kind of be an established ongoing thing. Again, I tell everybody that Mayor Mendenhall did not start working on equity work at the pandemic or the earthquake or the inland hurricane or racial unrest or anything like that. Equity, inclusion, and belonging is very much a pillar of her administration. And she sat down with me on Tuesday, January 7th. She was inaugurated on Monday, January 6th, and Tuesday she sat down and said, what are we going to do to work on elevating equity within Salt Lake City? And we began working on it. And so we're currently working on an equity plan for Salt Lake City. And that will just be the framework. It's almost like the lens of equity and the framework of equity. We kind of want to bake that into everything that we do. And we need to start with that. So we've got a consultant that's coming on board, someone, there's still an RFP process that's finalizing, but someone will come on and start working on that. She pushed forward the digital equity policy that had been a little bit stuck over the last couple of years and pushed that through. Also, after Memorial Day weekend, she created the Racial Equity in Policing Commission, which is now a very robust volunteer commission that is so large, it's broken off into 3 different groups that are working with the community, Human Rights Commission, and Salt Lake City Police Department and the Salt Lake City Mayor's Office to kind of come up with, how we need to take a look at things. The language access policy is going forward, and we had to do all of this, even as I work in diversity, equity, inclusion, and belonging. It was really interesting that this pandemic caught us off guard. It caught us off guard, even in the inequities that we thought, should be something to focus on. There were a lot of times where we were a little bit caught off guard and had to brainstorm on how to solve this and I didn't include some of the other inequities that were exposed with coronavirus and everything going online. You've got digital equity, you've got language access, reading comprehension, but then there's also food equity and transportation equity. And I thought this one was really interesting, where everything closed, schools closed. So a lot of the students who qualify for free and reduced school lunch, and a lot of those families rely on school lunch as a primary source of feeding their children, immediately closed. And we have these pop-up, the schools, ever so innovative, reinvented themselves overnight, pivoted, and had to do almost like pop-up food distribution. And it has been amazing and overwhelming that what we thought was somewhat short-term, 3 months turned into 6 months, 9 months, 12 months, that school districts have been doing these pop-up drive-through pantries for all of their students and the families of their school district. And it's been amazing. But then there still has been transportation equity, food equity and transportation equity, because their drive up, they have to be outside, COVID safe. They need to be, socially distant. But we found that if, again, families that make under $30,000 a year don't have access to transportation to go to that drive up food. I mean, it's a wonderful pop-up food distribution, but if they don't have a car, if they don't have access to that, there's no way that they can pick up their children's school lunch for the day, for the week, and their food for their family. And so we had to work with, again, partner organizations, UTA has been, the community liaison at UTA has been a phenomenal partner. We have pulled her into many discussions because we realized that a lot of the constituency that we were trying to reach took public transportation. And so we needed to partner with them immediately. And we had partnered with them in the past, I would say infrequently, but we realized that in order to get the information out the fastest in front of the communities that we needed, we relied on UTA, and they helped us with flyering and postcards and information at bus stops and even information on their digital app and everything. And so that actually worked out really good. But I didn't get deep into food equity or transportation equity. And this is what I think the aim the goal that I'm trying to talk about is you just aim for an equitable approach at your emergency management response. So the goal is to develop policies and practices. This is stuff like I had to learn that the hard way. This is stuff we needed to have in place prior for the disaster preparation field to better address considerations for vulnerable population. In other words, we seek to develop an equity approach within emergency management that contemplates how to meet people's needs based on their unique circumstances and actively seeks to remove complex systematic barriers that inhibit success in order to better protect communities and foster safer, more resilient communities for all. And so I'll open it up for questions and answers now on maybe what you experienced in your community and how your community responded.
Anyone have any questions? You're free to unmute and ask them, or go ahead and post them in chat and we'll ask for you. Okay. No one's jumping on the chat.
I'm curious if there were any unique situations that they found in their COVID experience.
Within your facilities, did anyone have anything unique that you experienced? No? Oh, got a quiet group here today.
Oh, Lori Harding.
Yeah. Go ahead, Lori.
I am curious to know if you've done any research on those that were not able to socially distance or take sick days off, and how companies are expected to cover the individuals, and how are the individuals expected to stay home for 14 days, 2 weeks without pay, and how has that affected our state?
I don't know if that's a great question. And it sounded like there were a couple different questions in there as far as when we are finding in the diverse and multicultural community, they're not able to stay at home. And so what we found, which was scary because when the numbers came out and they were disproportionately affected, we had to crack open those numbers and we're like, okay, they're not wearing personal protection equipment. They don't have access to personal protection equipment. They don't have the latest and greatest coronavirus information in their language. And so they're not understanding. So we had to hurry and take care of those really fast. So it was like messaging was going out, reaching out to communities. What do you need? How can we help? But then we found that families were like, I'm not going to go without work. I'm not going to work. If I don't work, I don't get paid. They weren't offered the luxury and privilege that some of us have with paid time off, or even if you have a positive COVID test. So guess what we quickly also discovered? You and I could buy a COVID test, a negative COVID test on the black market, because they were using that to go to their employer and say, I'm negative, when they never got a test, positive. And I was like, and again, I was like, there's a market for this. This is happening and there's a market for this. And so that's when the state multicultural, Nubia Pena at the state multicultural affairs division and the governor went to employers and were telling them, look, we've got a problem. This is what's going on. We need you to allow them, to go get a COVID test, to encourage it. And that's where a lot of the Utah Department of Health pivoted and they started doing all of the workplace testing. So they're going directly to the workplace. You're coming to work. Do you know what I mean? There's going to be testing. It's okay either way, if it's positive or if it's negative. It was more of a helpful approach instead of punitive, trying to highly encourage people to get actual COVID tests, and then helping them advocate and working with their employer to give them the time off necessary to quarantine. So yeah, we've had to change and pivot, as most of you probably have, every week, if not every day. Does that answer your question, Lori?
It does. Is there any funding to help those hourly employees and their employer, right? To encourage a few days off or to quarantine or anything like that? Was there any approved funding to help in that area?
Not that I know of. That would be a great question if we could supplement both employer and employee. I haven't seen that to the employers, but I know that for rent assistance, food assistance, everything, there were so, I mean, Utahns Against Hunger, United Ways, 211 has been amazing. Utah Food Bank has absolutely been amazing. LDS Church. I hope I'm not forgetting anybody, but the food response has been amazing. But it was also interesting, and I can tell a really quick story about that because I started working and they wanted me to make sure that food distribution was equitable. And I'm like, okay, I can take a look at that. So I very quickly, again, not an expert, learned kind of like the food emergency management ecosystem. And I just brought in several women who I knew were experts. And I'm like, you guys have been working in this for decades. So they are the experts, listening and learning very quickly from them. But what we realized is there were several barriers to food access. Again, the supply into the state was healthy and robust. The distribution to the pantries was doing well, but access to the food pantries, there were a lot of barriers. And I really thought, okay, we just have to overcome these barriers. So language access was one. They were like, all the information for the food pantries might not have been in their language, so they didn't know where to go or where to attend. Second was digital. Well, digital access was probably first. Language access, transportation, hours. So a lot of times the food distribution is in the middle of the day from 11 a.m. to 1 p.m., 11 to 3. It's only a short window of time. It's during the day. If they work, they don't have access to that at all. And so it was really interesting. So over weeks, we were like, let's just tackle these barriers. Let's just make sure and get that out so that the diverse and multicultural family can get access to the food that they need. This might be the first time that they are accessing the food emergency safety network. But then we ran into something that I didn't think it was there, but it was an undertone of racial discrimination. So we had families in partnership with community health workers who went online, found the nearest pantry or food distribution point, overcame the language barrier, brought the proper requirements for said food distribution, and were met with, you get turned away. You get turned away because sometimes the pantries and or food distribution points run like little fiefdoms unto their own, like a mom and pop shop. And there was discrimination because the community health workers were there advocating for the family, saying, no, they have all their proper information. Here's their utility bill. This is where they live. They're within the jurisdiction. Like everything is fine. Everything is order. We found the place. We found the transportation. We came to that. So we thought we'd overcome everything. And it was discrimination.
Yeah, that's horrible. So and I'm sure you have a couple other questions, but those that don't have transportation and they're using Uber or even a cab, I don't take that regularly, but is there any precautions for that driver if they're called to take them in for a testing? Like, has the city addressed anything like that to protect the people that get into the car next and even the drivers providing that service?
Yeah, that's the one thing that the state of Utah, GOED, Ben Hart has been absolutely amazing as far as securing personal protection equipment. And then I know that the city and the county, kind of our emergency command centers, we were just distributing that beautifully acquired personal protection equipment as fast as we could. So we got over 5,000 masks for all of the local pantries. And then Gina Corney of Utahns Against Hunger turned around and took it upon her and her staff to distribute it to all of the pantries. And the pantries were so extremely modest. They're like, we just need like 25 masks. And state of Utah, GOED was like, here's 100. You can offer to take 100. You're going to go through this. We're going to go ongoing. And Uber drivers, taxi drivers, entrepreneurs, Salt Lake City's Department of Economic Development has really been working with all of the businesses. They reached out to me immediately as well and said, Celina, this might not have been our area of expertise before, but we need some help reaching out to the diverse and multicultural businesses right now. And I'm like, let's do it. If we have to build it as we fly it, we're going to absolutely do that. And so they have been so amazing in working with my team as far as equity, inclusion, and belonging, making sure that whatever information they're getting from the state, from federal, they're disseminating to the diverse
Great,
community.
thank you.
Celina, Skylar also posted in the chat about a grant program that supports employees and employers with paying for time in quarantine. And he gave us a link there as well. So if you need more information on that, that's where you can find some more. And then I have a question here from Jason. Jason, she said, we had an interesting need that came up when we were running COVID simulations at various facilities. In one ICU unit, one of the RNs was very hard of hearing. She wears hearing aids, but consistently relies on reading lips. Using PAPRs and masks has made her job extremely hard. She said, it's made me rethink completely how difficult mask wearing with that population.
Yeah, that's a great situation. That is a great situation. And that is a perfect example. That came up in Salt Lake City as well. My colleague and counterpart is Sarah Benj, who is our ADA coordinator. And she received feedback really quickly from the deaf and hard of hearing community that all of this mask wearing doesn't help them at all. And so again, we had to rethink, and I reached out to several other colleagues, and the state of Utah, again, Ben Hart at GoEd helped us procure clear masks. So they're clear, and it was more, they were literally clear masks where they had a small window, and then everybody started getting into the face shields, but that was still prior. This was right after masks became a thing, that we looked and secured plastic masks, and we distributed them to the deaf and hard of hearing community. But then we also took it a step further, and some of our local retailers who we were working with anyway, who we wanted to make sure and give personal protection equipment, we were offering these plastic masks to them. Smith's has been a phenomenal, Smith's and Kroger has been a phenomenal leader, employing individuals with disabilities, and they're very aware about the differently abled and accessible community. They really lead out as an employer. We've identified them a couple times about that. Connected with their public relations department as well to offer for Smith's, individuals working at Smith's, they could wear the clear masks if they wanted to, so that they could then interact with the deaf and hard of hearing constituency. And so it was really, really good that we had to identify that really fast as well. Something we didn't think we needed at the time. And now the next step is my colleague, Sarah Benj, is currently writing the accessible policy for Salt Lake City so that we can then turn it into a plan and protocol. So we have it and we follow ADA, but ADA just barely turned 30 years last year, and it's not even that compliant. The majority of businesses and entities that are not compliant with ADA is a scary statistic. And so everybody always kind of barely meets the minimum of ADA, but the accessibility policy that we're putting together for Mayor Mendenhall is what is Salt Lake City going to commit to above and beyond ADA. And when we put it in policy, we need to make sure we're prepared to go with that as well.
Great. All right, and then this is a lovely comment here from Jeanette. She said, here in Carbon County, our bus drivers did their routes and delivered the food at each stop. It was very amazing. We have a lot of low-income families here. They stepped up and took care of those families. They also made extras for children who were not in schools yet. It was so wonderful here in our community. Also, our amazing emergency managers took control to make sure that the essential workers all had PPE.
Oh, I love it. That's a phenomenal success story. And you know what else they could throw on those buses too, Jeanette? Throw on a Wi-Fi hotspot. Just throw on a Wi-Fi hotspot. There were some cities across the country that were doing that. I think it was Boston City School District revamped their school buses really quick, and they would send them out to their normal bus stops, and they would park for 1 hour and then go to another bus stop, park for an hour, but they had Wi-Fi hotspots. And so families who were needing to connect to the internet knew at a regular time that the buses were coming through. So throw a Wi-Fi hotspot on that bus, and that's phenomenal innovation.
I love that idea. Okay, and then we have a comment here from Shauna. She said, I would like to add that I think the whole community has been the vulnerable population. The pandemic has affected everyone. We need to be careful in saying that there is a discrimination issue.
It's not necessarily a discrimination issue as it is just a disparity. There's a lot of research that backs up that vulnerable populations in general, I mean, there's some communities that are always kind of on the cliff of crisis, and we know who those communities are. And when you have back-to-back or even one emergency, it does tip a lot of communities over that said crisis cliff, where the response needs to be a little bit different. But no, you're 100% correct that this year, everybody, we're all in the category of vulnerable populations, because it has been in a lot of different ways for everybody. Domestic violence has been on the increase, where a stay-at-home order wasn't necessarily the safest place for some families or individuals. And so I have a lot of friends who are domestic violent victim advocates, and their work has significantly increased this year as well. And mental health. I don't think we've even talked about mental health on the state's multicultural subcommittee. There is a Dr. Ming Hao out of BYU who is absolutely amazing. And she always kind of brings us back to that, where we're like, this is what's going on. This is what's going on with said community, said crisis. What is our response? What do we need to do? And she's like, we need to check on their mental health. We need to check on how people are doing. And it has to start with that first before we ever rush in to advise, well, look at all this personal protection equipment that we have for you. We need to ask how individuals are doing.
Great. All right, we have time for one more question. If anybody has a question or a comment, you're welcome to unmute and verbally.
I would love to hear another success story.
Not sure if this is a success story here, but Lori asked Skylar if there are still funds in that grant. And then she posted later on saying that she did find the information. So if you still have questions about that grant availability, just look through the chat here real quick. We'll keep it open for a few more minutes after we close the presentation, so you can get those addresses. Oh, Jeanette also posted, we also have a local internet company, and they're offering families that don't have internet with school-age children free internet for 3 months. So
that is amazing. That is amazing. There's a broadband company as well in the state that stepped up completely to offer digital access, digital equity. And I know that in the city of Mill Creek, there's a partnership that's going on that has been, so it's Comcast Internet Essentials, that Mill Creek, the city of Mill Creek, stepped up to pay for the Internet Essentials for families that didn't have internet, to hurry and get them connected. Comcast was offering 3 months free, I think Mill Creek City, but then they also brought in United Way's Promise. And I've heard that other individuals in the community are so impressed with this program that they're donating. So you've got neighbors of Mill Creek who are donating to the other neighbors who might need the internet connectivity. And so I love the pay it forward.
Absolutely. All right.
Thank you so much. No, this has just been a pleasure. Like I said, I am not an expert in emergency management, but I have been looking at equity, and I just want to make sure that in your future COVID plans, COVID 20 or whatever plans, as we take a look at it, if we can make sure and always remember to put that equity lens on and aim for an equitable approach in our emergency management planning.
Great. Well, thank you so much, Celina. This was some great information, stuff that I think a lot of people just don't think about. So we appreciate your time today. We appreciate you getting this information to us. I'd also like to thank my colleague, Dr. Karen Blackwood, the director of the ICDP, and also to remind you, I just sent out the SurveyMonkey evaluation link. So please take a few minutes. According to SurveyMonkey, it only takes 4 minutes to do it. I did it in about 2. So it doesn't take that long. Please fill that out so we can get your information and make our presentations better for the future. Again, if you're watching with a group, please email me your numbers or their names. I did get a few of those already. And if you were on a phone and called in, please text me your name if you want credit for the class. There were some questions about whether or not this video was being recorded, or this presentation was being recorded, and yes, it was. We will have those video presentations available after the final symposium presentation next week on November 18th. So I will send a link out to everybody so you have that. Again, we thank you for your support. Please watch for the 2020 calendar of courses and events coming up from the ICDP. I should have that out in the next few weeks. And yeah, hopefully we see you next week at our final symposium presentation, Wednesday from 11:30 till 1. And till then, everybody stay safe, and thank you again for coming, and thank you, Celina. And as I said, I will leave that chat open for just a couple more minutes. There's a lot of thank yous to you, Celina. A lot of great information. Appreciate the presentation, et cetera, et cetera. So anyway, great. Thank you all, and everybody have a great rest of your day. And Celina, I have someone who wanted to contact you directly. So I don't know if you saw that in there, but I will send you that phone number so you can give her a call, okay? All right, great. Thanks, everybody.